Hello and welcome to the third of 4 educational mini-series provided by the Berks County Area Agency on Aging. My name is Barlet and I'm the Manager of Community Outreach and Education for the agency. Our third series is on getting healthy and staying healthy. And this segment today is focused on use it, don't lose it. A little twist on the typical phrase that we've been saying around a lot. And our focus is obviously on really fitness, physical activity related so that we can get a little healthier and stay a little healthier over time and in our senior years. My guest today is Dr. Christopher Weiss. He is a physical therapist as well as the director of the Doctor of Physical Therapy program at Alvernia University and, of course, an associate professor at Alvernia. So welcome, Dr. Weiss, if I may call you Chris. I appreciate
Absolutely.
that.
Thank you, Ann. It's good to be here.
Thank you. All righty, we're going to jump right into the segment. Again, the focus is on getting healthy and staying healthy, and we're looking at activity, physical fitness in order to do so. So I guess we should really start with what is getting healthy, staying healthy, health, wellness. Maybe you can share that with us. That's a great question.
I think oftentimes we misinterpret maybe what wellness actually means, and I think it's sometimes better to define wellness maybe first by what it's not. Okay. And when we think of wellness, it's really not just the absence of disease or some disorder. Mm-hmm. It's also not something that's really outside of our own personal control. A lot of the things that kind of get us into the type of health that we have is often based on personal decisions that we make throughout the course of our lives. And so when we think about wellness, we really want to think about it almost like what sometimes is used as an analogy would be like a wellness tire, for example. And we think about the wellness tire, we think about the many attributes or dimensions of wellness. And it's not just physical, which we sometimes think about, but it can be emotional, it can be mental. There's a spiritual dimension to wellness as well. And so when we look at that well-balanced tire that's running nice and even, as the car drives down the road, we think about wellness and all the different dimensions. And we really want to think about how we can kind of bolster and ensure that each of those dimensions is really, fully inflated per se. And really operating at full tilt.
And one of the things, as I think about the tire analogy and the different areas of wellness, as you said, the spiritual, and it's like a cycle, and it all connects to one another and makes the next one work. In other words, you're right, we think of physical wellness, so you think of, oh, a cold, I'm sick, but also, if I'm not feeling as good and I'm sluggish or whatever, doing exercise then helps to boost not only, me mentally because of the endorphins, and then I'm feeling better, and then I'm able to, so it is also the tire of that cycle, isn't it?
Absolutely. Okay. I mean, sometimes we think of the physical being so unrelated to other areas, and we don't have time to do the physical component, but I think a good way of thinking about it is really looking at how the physical dimension really impacts, and really all of the dimensions are interdependent. And so I think as we now obviously focus today on looking at physical fitness and the physical aspect of wellness, part of the concept here is to understand and appreciate how that will impact those other components and dimensions of wellness also.
And so it's not too late also. I mean, we're talking a full spectrum, so it's not too late, I'm going to say at any age, right, to develop some kind of physical activity, a fitness program, something that we can do, right?
Absolutely. Okay. The research is really pretty good to show that, even up into our 60s, 70s, and 80s, and even beyond, there's still the capacity of the body to respond to activity. And so as long as we're, operating at the correct intensity for a long enough period of time, we oftentimes can really get significant results and improvement in our overall physical fitness and well-being, even at older ages.
Okay, great. So we talked a little bit about that tire and the connectedness and the components of health and wellness and what it's not. So let's talk about, we're talking about then physical fitness, physical activity. Now, I am not a big, I believe in it, but it kind of, I need that, what it is, why, define that for me, because I'm really not going to be a person who's going to take that extreme. You know, we think of fitness too as, you know, somebody who's running marathons or a runner or, you know, to nothing. And so, you know, I will tell you that I've asked people in the past, how do you do that? You know, and they'll say, just move more. So let's look at defining physical fitness. Can you share that with us so we know what we're talking about?
Absolutely.
Too with that?
There are a lot of definitions, I would say, of physical fitness, but if we really look at it, it's really the ability of an individual to respond to life's demands. So as we're going throughout the course of a normal day, physical fitness is really the physical capability for us to respond to the things that we experience, the things that we're required to do, our normal activities of daily living, but to still have a little bit of reserve for those things that may be unexpected. For example, it's that time of year where we're experiencing snow and ice and things of that nature. So, you know, being able to have the capability, the strength, the mobility, the balance to be able to go from maybe our house to our car is, you know, something that we typically do on a regular basis. But to do it with weather conditions and to be able to respond to maybe those unique demands and to do that successfully is really how we would define physical fitness. So it's very individual. It's very dependent on people's normal activities. But it's really the ability of the physical, of the body, to be able to respond to what those demands require.
And I like the fact that you said that it responds to life's demands. So what I do everyday life, as you said, go from the house to the car, getting in and out of the car, you know, in and out of bed, up and down steps, carrying groceries, all the things that are part of daily life. And you know, we can maybe do that easier, better, longer, safer with some sort of fitness or physical activity.
Absolutely.
Right? Okay.
Yeah, absolutely. And there are many components of physical fitness that we sometimes talk about, and some people, you know, express to me often, you know, when I see them, oh, you know, I'm pretty fit because, you know, I walk around the block and, or, you know, I get on the exercise bike and I do some exercise and things of that nature. And although that's great, and we certainly want to encourage that component of physical fitness, we have to also gain an appreciation that there are many aspects to physical fitness. So we can think about, for example, cardiorespiratory fitness, where we're working on improvement of the ability of the heart and the lungs to be able to function. But that's not the only component. We also have muscle strength, we have muscle endurance, we have things like flexibility and mobility, we have things like balance and coordination. So when we're looking at trying to enhance our overall physical fitness, it's important that we look at an approach that allows us to be able to engage in exercise that really addresses, you know, all of those individual parameters.
And so engaging in some exercise is going to help in each of those areas, which will help us improve our daily lives and those demands that are on it, right?
Absolutely.
Okay.
What I've learned early on as a physical therapist is we have to connect this to function and what's important to people. To simply do exercise for the sake of doing exercise is a tough, is a tough sales pitch.
I may say.
So we have to connect that to what's important to people. Absolutely.
Okay. Yep. Excellent. Because again, that's also, you know, my problem is that motivation. So why am I doing that? Yeah, you know, you can tell me all you want that this is good for me and it's healthy and it's, you mentioned the cardiorespiratory system and, you know, but if you showing me and telling me that how it's going to help me and to meet life's demands, I think that's really more of the motivating factor for me and many people.
Absolutely. And like you said early on, Ann, I think it's important for individuals, seniors in particular, to recognize that it's not too late, you know, that your body can still respond to these things. I mean, we know when we look at the cardiorespiratory system, for example, we have basically, we maintain our ability to consume oxygen that's very comparable to what we had when we were younger. The biggest issue when we think of the heart and lungs and the way that they function is typically seniors oftentimes are operating at a higher capacity of their overall ability physically. So what that often means is that the heart and the lungs are in a position to be able to improve, but oftentimes it's a lack of efficiency that comes from muscle weakness and issues with mobility and things of that nature. So when we look at muscle strength, for example, we know that as we get older, there's a diminished size, cross-sectional area of muscle as we get older. And that sometimes, you know, increases exponentially as we get older. But what's interesting is that the enzymes that are responsible for metabolism of muscle, to allow that muscle to do the things that it needs to do, are still there, are still present, and are still intact. So changes can be made oftentimes those changes, though, require choices by individuals. So it's not as though, oh, I'm just going to be weak, you know,
Yes.
or
I was
my
gonna
bone
say
is
that we
going to
accept
demineralize.
that we're aging and blame
Right.
everything on aging, and that's just what happens at aging. No, it happens with aging and because we're not using it.
Right.
So, but it's still there, and the capacity is there to
Right.
improve it. Okay.
Now, some things change, certainly, and it makes it more challenging. Bone, for example, we know that after the age of 60, we lose on average about 1% per year as far as bone mineral density. But with bone, for example, exercise is a great way to combat that because we know that forces that are placed through bone often help to increase bone activity. And so, you know, exercise, you know, does have the potential to really reverse or at least curtail some of the changes that are expected as we age.
Okay. And it's and the bone health will keep us in alignment, I guess, you know, with that. And then we've got the muscle health, right, that will also help, and both together will give us, as you said, the strength and the endurance and the balance and things like that.
Absolutely.
Okay.
Absolutely.
How about anything else before we, you know, any other pieces of physical fitness before we talk about some of the more additional benefits of being physically fit?
I think that probably it's important as we're looking at trying to have individuals embark on an exercise program, and hopefully through viewing this and other resources, you know, we've kind of made, you know, a good case for being able to become involved, you know, and be more physically fit. And I think that the point that you made about how, you know, all of these things are connected where, you know, improving strength will improve balance, which will improve our ability to be able to negotiate around our home and outdoors without fear of falling and things of that nature. So I think that, you know, when we kind of look at some of these aspects, I think it's important for us to think about how we may construct an exercise program to be able to kind of touch on each of those different aspects. And so as we're looking at that, there's some important things that we want to kind of talk about in regards to maybe some general guidelines that might be helpful for individuals that may be kind of thinking, oh, you know what, they've kind of sold me on this. You know, I think that this is something that I think may be beneficial, not just something that I need to do, but something that really, truly does make a difference in my ability to get around. And so for those individuals who are looking at that, there's some important things that we should probably keep in mind before embarking on such a program.
Okay. Share those with us.
Okay. Safety first. So we
Okay.
always think about, you know, what's the safest way to begin to embark on something like this, particularly for individuals who maybe have not exercised before, maybe something that's new to them. It's always good before
Or we haven't,
embark.
obviously, if we haven't done anything either, we may have been active younger, and now there's been a gap when we haven't been, and we have been sitting around. So our muscles, you know, we think, oh gosh, I get up, I'm aching, and it's because we haven't used it. So
Right.
before we start, then the safety
Yes.
is key. So tell us more
Yeah,
on
I mean,
that.
it's always good before embarking on any exercise to check with your physician first.
Okay.
So make sure that you see your family physician and just make sure that you get clearance, that you're physically, you know, at the point where you can embark on an exercise program, regardless of really what type of exercise program, because potentially, if there are some physical issues going on, doing exercise and overloading the system may not be so good. So it's always good to check with your physician first and get clearance before you embark on any exercise program. I think other ways to be safe is as you're embarking on the exercise program, it's always good to be able to monitor your vital signs, things like your blood pressure and your heart rate. There are lots of a lot of cost-effective devices that are out there now where individuals can kind of monitor some of those things on their own. And that's
If
always
I
kind
don't
of
have those modern devices or can't get out to get them.
Yeah, I mean, you know, being able to monitor your heart rate is something that a medical professional would always be able to teach individuals. I've taught many people how to do that over the course of many years. And so that's something certainly that many people are capable of doing. That's a good idea to kind of do throughout the course of the exercise. I also think that it's good to understand the kind of no pain, no gain philosophy, and I think that we hopefully will, you know, that's a myth that we certainly want to, you know, get rid of. Exercise should not hurt. You know, as we're going through, certainly there may be some muscle soreness that develops in response to working muscles and joints for the first time, but that shouldn't be anything that is producing discomfort that lasts for any period of time. So, you know, getting rid of the no pain, no gain, I think is an important guideline for people to understand.
And on that same wavelength, I think when you're talking to your physician and saying, I'm thinking of doing this, that's a good time also to make sure that there isn't an area that maybe you have injured in the past or you're having a problem with, that they say, just sort of watch, you know,
Right.
your shoulder, or, you know, something like that. Also
Right.
have that you know, when you're just talking to your physician, so that you don't create more pain
Absolutely.
by using
Yep.
it or using it
Absolutely.
wrong.
Right.
Okay.
Yep.
All righty. There was something also, what I wanted to talk about too was how all of this, you know, we're looking at embarking on something physical, and I think we get that mentally, but that motivation, why, you know, I'm doing the things around my house, I'm sitting in my chair, I'm watching my TV, I'm going over here. I think I've noticed over time, though, that some of us compromise what we do because we are limiting ourselves and don't do the physical activity. So we don't go out as much anymore, or do some long distance things, or consider, well, how am I going to get there if I've got to go by bus and I've got to go up the steps, or, you know, at home, you know, maybe I have a 2-story house, well, I might be bringing myself down to the 1-story because I don't want to do the steps anymore.
Right.
So instead of limiting ourselves in that vein, and once we've been approved, we can kind of open that up and increase that to, again, all of it ties into that staying healthy, being healthy and staying healthy for whatever we want to do in the future. So I think what we'd like to do is, I know we're going to do some exercise demonstrations to give folks some thoughts as to what we can do in our home. But, okay, so before we do that, I know it mentally, but give me more on, so motivate me. Tell me how some of these exercises, and maybe we can do a little bit of both while you're doing it. What, you know, yes, I should. Give me a little bit more on the benefits. I mean, because, you know, how will it increase a capacity to do, to maybe walk a little further to, I want to go out to an event, but I know it's, you know, from here to here, and I'm not really sure, you know, so give me some general, motivate me.
Okay. I mean, I think sometimes when we look at some of the tasks, you know, I think as we get older, we kind of create new normals. So, you know, as we're younger, you know, the world is ours, and we're able to do what we want to do, and we don't really think twice about it. And I think, in particular, individuals that are currently seniors are used to working, not working out, but working.
Right.
You know, and back in the day, you know, there were a lot of individuals that were involved in heavy labor activities or on the farm, and so a lot of those things kept us healthy and kept people functioning and moving. And as we get older, I think, you know, we keep moving the bar lower and lower in regards to the expectations, and some of that is associated with our thoughts about, you know, wellness and kind of, well, I'm getting older, and that's kind of how things should be. And, you know, we want to look at wellness really on a continuum, you know, from perfectly healthy to death. And so as we're looking at that continuum, again, you can't emphasize enough the capacity that we have physically to be able to make changes. And really, it's choices, whether the choices we're making currently or choices we've made in the past. But many times the level of wellness or health that we're currently living with are based on our own choices. And so, you know, it is something that is within your control. I always say, you know, that the best motivation for individuals is really kind of embarking on a program, and if you can kind of hang in there for those first couple weeks, and what some of the literature seems to show in regards to things like strength training, you know, 6 weeks or so is usually adequate time period to begin to see some changes. With heart and lungs, oftentimes about 3 months we're looking at being adequate time to be able to make some changes. So oftentimes we can get past that first hurdle of being able to, you know, kind of get into the exercise program, you know, make it a habit. I think what's often important is for individuals to kind of make it part of their day. It's not an additional thing that they have to do, but they incorporate it into their day, and it becomes part of what they're doing. And then once they start to see those changes after that period of time, where now, wow, I can go upstairs and I'm not out of breath.
Yep.
Or I can walk, you know, from the kitchen to the living room, and I'm not losing my balance. And when we start to see those types of things, that's the best motivation I think we can have.
It is, and I'm glad you said that, because obviously that we do need to sit back and recognize that those things, those the things that we do daily are improving because of being physically active and working on some kind of program. So obviously that's a good lead-in to let's show folks. You mentioned is incorporating it into your day. So I'd like to show you, you're going to demonstrate some exercises that we can do in our home, right?
Absolutely.
Even before we might want to embark on a more formal program or an organized exercise routine group. So let's get you over there, and we will introduce our special guest with us, who will be helping to demonstrate the exercises. So Chris, get on over there, and we'll show the camera on Chris and our guest. I'd like to introduce Joanne Ensminger, and I will tell you that she is Chris's mother-in-law. So I appreciate you being with us today. Thank you so much. All righty, Chris,
Excellent.
where do we want to start with some exercises?
So I think when we're looking at formulating this, as we said, Ann, what we're trying to do is really get individuals into the habit of exercising. So this is kind of a start, to kind of just get people into it. And what I really hope to show is not an all-inclusive program, obviously, but really how you can get started with really nothing more than a chair. I'm going to bring out a resistance band here in a moment, but we can really begin to do some really great things just with these few items. Typically, we're looking at trying to engage in an exercise program that involves a little bit of warm-up first, oftentimes doing a little bit of some stretching to improve mobility and flexibility of the muscles and the joints, and then also beginning to embark on doing some strengthening of both the arms and the legs. And so typically, we're looking at about a 3-time-a-week type scenario that often is beneficial. Less than that, probably not enough, and more than that, maybe too much. And then we're looking at taking a day off in between and probably exercising for about a half an hour to 40-45 minutes, something in that range. So again, check with your physician first, but as far as some general guidelines, they are often helpful.
Okay, thank you.
So the first thing I'm going to show Joanne today is we're going to do some lower extremity stretching. We're going to begin kind of low into the calf. A lot of people have calf tightness, and then we're going to kind of work up into some of the other areas. So I'm going to ask Joanne to stand up for me if you would. And I'm going to just turn this chair this way, Joanne. I'm going to have you face the chair here for me and hold on to that chair. And let me have you bring that right leg behind you. Go ahead and bring that back for me this way, where you're on the floor, and back this way. And what I want you to do is let me have you keep that heel on the ground, keep that knee straight, and then just nice and slow, let me have you lean toward the chair, keeping that knee straight. All right, so as we're doing this exercise, we're looking at feeling some stretching in here. Do you feel that, Joanne? And so when we're doing stretching activities, the best parameter to work under is to hold that stretch. A lot of times people bounce or they'll go really quickly.
Yes.
So really you want to hold that for about 15, even 30